After surgery, you'll be provided with a game-ready machine. The game-ready is to provide ice and compression to the shoulder. It comes with a unit, the plug-in device, a cuff, which is right here, and the tubing. To plug in the unit, plug this portion into an outlet, this outlet portion into the transformer. Make sure that this is secure, and this portion into the front of the device. The power to the Game Ready button is right here. By pressing that, the Game Ready will turn on, run through a self-test, and default to a 30-30 mode. 30-30 mode means that the unit will apply pressure and ice for 30 minutes and pause for 30 minutes. It will run through this cycle for 4 hours. The small bar at the bottom of the right-hand screen means that there is no pressure. By hitting the timer button, you increase the pressure by one segment. This is mild pressure, moderate pressure. This defaults it to a 15-minute screen that allows you to run the unit for 15 minutes without any cycling through a pause time or an on time. If you're on this screen, you can use the plus button to increase the amount of time the unit is on. By hitting the pressure button, you can increase the pressure. A single line means that there's mild pressure. Small mountains mean moderate pressure, large mountains, maximal pressure. One more time, deletes or excludes all pressure that is applied to the cuff. This knob decreases the temperature of the unit. So 3 snowflakes means the coldest setting. Turning it to a single snowflake is minimal coldness. This is the basin where you add water and ice. It is recommended you add about 2 inches of water and fill the rest with ice. Dixie cups filled with ice or large ice chunks will last longer for the unit. This is how to put the Game Ready cuff on and turn the machine on so that you can start applying ice right away. So Lindsay, let's have you hold on to the cuff. You're going to bring it onto your right shoulder. Try not to use your arm as you're doing this. Section, go ahead. Now with your right hand, grab this portion, this tab right here. Bring it, secure it onto the Velcro there, tight as you can. With your left hand, reach behind you. Strap that one up as high as you can toward your shoulder. There's one more tab right under the elbow here. Can you get it? There we go. Good. Now you can turn the machine on. The machine's on already. Be sure to check these hoses here. Sometimes if they're not connected correctly, the machine will give you an error. Now you can go ahead and hit the play button. As you hit this button, the start pause button, the machine will automatically send cool water to the cuff and pump it up with air if you have a pressure setting on. This part of the video is to describe a little bit of the basic anatomy so everyone has a bit of an understanding of where the muscles lie and the bones are. The shoulder is a ball and socket joint. It's made up of the humerus bone right here. The humerus bone has a spherical head that attaches right to the shoulder blade at a part called the glenoid. The glenoid is the socket of the ball and socket joint. On a regular shoulder, we see that the humerus is here, the shoulder blade is here, which would be on Lindsay's back here, and then we have the clavicle to the front. Clavicle is right about here. The muscles on the shoulder are pretty simple. We have rotator cuff muscles, there are 4 of them. One sits right on the front, that's called the subscapularis muscle. On this model we can see the subscapularis coming to the front of the shoulder, this being the clavicle. If we looked at the subscapularis muscle, it would be to the inside right here. The supraspinatus muscle, if we flip the shoulder blade onto the back, this is the supraspinatus muscle, which sits right here. These other 2 muscles are called the infraspinatus and teres minor muscles. We'll show those on the back side of the anatomy. On the front side, we see a few things. One is the coracoid process, which is a piece of bone that sits right here. We have the acromion, which is the bridge that sits over the humerus bone, which is right here. The muscles on the front of the shoulder are the pec muscle right here, pectoralis major. If you lift the arm up, these are the lat muscles. The subscapularis muscle would come right into here. The bicep muscles are here, and the front of the deltoid is right here. We can see where the supraspinatus muscle would come down. On the muscle model, it looks just like this. We can see this, the supraspinatus coming down under the acromion onto the humeral head. Supraspinatus again sits right here. The deltoid muscle has 3 heads, one being right here, one here, and here. This is the deltoid muscle. From the back side of the shoulder, this is where we can appreciate a few of the other rotator cuff muscles. Again, supraspinatus would sit up here. Infraspinatus sits right here, again attaching to the humerus bone right back here, and then the teres minor muscle, which comes up to here, and again attaches to the humerus bone. On the muscle model, we can see these muscles right here again. Supraspinatus, infraspinatus, teres minor. So in this section, I'd like to describe a few of the motions of the shoulder that you'll be involved with your postoperative rehabilitation. First, forward elevation. Forward elevation is bringing your shoulder up and above your head, like this, and back down. We measure this by calling this 0 degrees of forward elevation. Your arm is directly in front of you. This is 90 degrees. And all the way up, typically the shoulder will go to about 170 degrees or 180 degrees of forward elevation. Back down. Internal and external rotation are measured from here. External rotation is simply the motion of rotating the arm out to the side. If you can visualize the humerus bone inside of the body here, the humerus bone is rotating toward the outside and back toward the inside. The humeral head is rotating out in a clockwise fashion here and counterclockwise as we go in. Internal rotation is measured from here going to the inside, just like this. Since the body blocks the amount of internal rotation, we can also bring internal rotation onto the back. This is maximal internal rotation. We measure that by how far you can get your hand up the length of your back. Forward elevation in the scapular plane is simply elevating the arm out to the side. We call this the scapular plane because the orientation of the shoulder is more out to the side of the body and a little bit to the front rather than directly out to the side. Forward elevation in the scapular plane can go all the way up and back down. Typically, this is a very comfortable motion for the shoulder. Abduction is similar to the movement in the scapular plane. Abduction is done by moving the arm directly out to the side and up, back down. Again, abduction, all the way up, back down. We can also internally and externally rotate the shoulder in an abducted position. We call this position the 90-90 position or the thrower's position. Internally rotating from this position is done like so. Externally rotating is bring the arm back as far as possible. It should be noted that this position is an extremely provocative position for throwers or anyone with anterior instability of the shoulder, and it should be avoided during postoperative rehabilitation. So again, external rotation in the 90 degrees of abducted position and internal rotation in the abducted position. Good. Internal rotation again is done like so. We measure it by how far you can reach your thumb up the length of your spine. Normal internal rotation can go up to about midway between the shoulder blades. Back down. Go one more time. Back down.